In Senegal, malaria and diarrhea are the leading causes of death. Malaria on its own accounts for 9% of the total deaths in the nation, and diarrhea accounts for 15% of the deaths in children under the age of 5. Over half the population of Senegal does not have access to reliable and effective sanitation facilities. At Turp Relief Service, we see a Senegal in which malaria is completely eliminated, and child mortality rates are brought to levels similar to those seen in the developed world as early as 2030. As an organization, our mission is to make a positive impact on the health of the Senegalese population by providing access to medical facilities and resources, improving sanitation facilities and access to clean water, and educating the populace on how to best utilize these resources or how to personally make improvements within their community. As an organization, our goals for our 2030 deadline are to reduce the infection rate of malaria by 50%, educate the population on the symptoms and risks of malaria, and reduce the number of deaths from diarrhea in children under the age of 5.
Our first objective is to provide medical resources for malaria treatment and prevention nationwide, as well as provide netting for citizens of Senegal. Allocation of medical resources will be decided based on current access to medicine and severity of outbreaks. We will also invest in mosquito nets to prevent infections during sleep. One significant risk associated with malaria mitigation is improper use of bed nets. Bed nets are cost-effective, however, they are oftentimes used as fish nets in coastal regions of poverty rather than for protection from mosquitoes. In order to circumvent this risk, we will educate the population on mosquito nets and the importance of keeping them over beds to avoid risk of getting the disease at night. Additionally, using these nets for fishing poses harmful environmental effects that will deplete their communities and important food source. In order to measure effectiveness of malaria reduction, we plan to track the number of new cases of malaria at hospitals and observe statistics of whether or not malaria rates have decreased 50% by 2030.
Our second objective is to educate the population of Senegal on the symptoms and causes of malaria so that they can take an active role in reducing deaths by malaria. Our approach will be to contact the Senegalese government and look to start programs which help educate the public. Hopefully, we will be able to craft a program where Turp Relief staff can come to Senegalese schools with the hope of educating both children and their teachers so that they can continue to teach students sustainably after the Turp mission is over. One of the anticipated risks to this approach would be ensuring proper education. It will be difficult to ensure all teachers in Senegal will communicate all information effectively to their students. However, we believe that this problem can be solved by our cooperation with the Senegal government, who will help our education initiative to reach all parts of the nation. We will also host education programs and training sessions to educate teachers on malaria symptoms and causes, as well as send Turp Relief Service staff members to schools and cities to educate the youth and population of Senegal. To measure effectiveness, we will measure statistics to see if observed medical cases and deaths by malaria decrease.
Our third objective is to decrease deaths that are caused by diarrhea, particularly in children under the age of 5, as they are the most susceptible. One problem we may encounter during the education of the public regarding the risk of dirty water and diarrhea will be their apprehensive nature of dealing with Westerners. Another risk may be that distribution of the treatment becomes costly, as it is not a one-and-done treatment. It requires multiple doses. Along with this is the awareness of the treatment, because there will be those who require aid but do not have knowledge of it, as they are in rural areas. We will work to mitigate these risks by working with local leaders to teach ways to deal with water impurities and how to reduce risk of drinking dirty water. This way, the community will be more willing to implement these safety measures. For distribution in urban areas, there will be centers around the cities for people to pick up diarrhea medicines, and rural areas will have weekly deliveries of the medication to community centers. For awareness, we encourage word of mouth and with posters around the city. To measure the effectiveness of these measures, we will monitor the deaths caused by diarrhea of children under the age of 5 years old.
To maximize our budget and efforts, we will work alongside other like-minded organizations also working in Senegal, such as UNICEF, and use any facilities or resources they are willing to share with us to meet our goals. We will also work alongside community and religious leaders to ensure the populace heeds our message, while using any educational resources already in place, such as schools, to incorporate malaria and diarrhea education into their curriculums. While our objectives run till 2030, within 5 years we expect to bring clean water access to the 25% of the total population which have no current access to clean water or sanitation facilities, reduce child deaths due to diarrhea from 15% to less than 8%, and reduce malaria deaths in the country from 9% of total deaths to under 5%.